What is important to know for every myeloma physician is most of the infections are respiratory tract infections. So, and usually viral infections are the door opener for a bacterial infection. So we have to do, that is why we have to vaccinate our patients. And if a viral infection occurs, we have to be very careful, and the patient should be informed, because if that is not controlled, it may lead to a bacterial infection, it may lead to severe pneumonia. And sometimes patients come to their physician and they are doing quite well, but sometimes they come and say, I have a problem because since yesterday, 3 o'clock in the afternoon, I feel weak, fatigued. So if that happens out of the blue, the physician should consider that infection may be the underlying cause, so he should examine his patient carefully, look for CRP levels to exclude a bacterial infection, and of course investigate the upper respiratory tract in order to exclude viral infections as much as possible. And if you search for viral infections, you want to confirm which virus is causing the infection, you have to use PCR technologies. Don't use antibody testing, because antibody testing usually gives you often or bears the risk that the result may be negative because the antibody formation is impaired in our patients. So do a PCR, and there are new techniques available in the future, and there will be more will be available in the future, using multiplex PCR systems which are able to detect different viruses. Presently you have to order PCR for respiratory syncytial virus, for I think influenza, for adenoviruses, CMV, EBV, enteroviruses. But in the future you will do one multiplex PCR test which covers a series of viral antigens, and then you get a better view. And there are already comparative studies showing that the new technology will be superior.